Did you know that autism affects 1 in 150 births? According to the AmericanSociety.org, 1 to 1.5 million Americans have autism. Autism is the fastest growing developmental disability. Autism also makes up $90 billion in annual costs. 90% of those costs are in adult services. Cost of lifelong care can be reduced by 2/3 with early diagnosis and intervention. In 10 years, the annual cost would be $200 to $400 billion. What is autism? Autism spectrum disorder is a developmental disorder that is usually noticeable within the first 3 years of life. It is a neurological disorder that does not allow the brain to function normally. This disorder is usually common among males, although there's also a significant number of females under the spectrum. What does autism affect? It affects the communication, both verbal and nonverbal, social interaction and play skills, as well as imagination and imaginative play. The first thing it affects is the impairment of social relationships. For example, as a baby, the child does not reach to be held by the mother or seek cuddling. The child does not imitate others, they use adults as means to get what they want without interacting with the adults as a person. The child will not develop age-appropriate peer relationships. They prefer to be home. There's little or no eye contact, and also detached from their feelings of others. According to the book Autism Spectrum Disorders, the second characteristic is an impairment of social communication, which includes the child will not develop speech or develop an alternative method of communication, such as pointing and gesturing. Has speech, then loses it. Repeats words or phrases instead of using normal language, and this is known as echolalia. Speaks difficulty in talking about abstract topics, and lack of impairment or conversational skills. And the last characteristic is impairment of imaginative thought. This includes inappropriate attachment to objects, obsessive odd play with toys or objects, such as lining them up or spinning continually, does not like to change in routine or environment, will eat only certain foods, will only use the same objects such as the same plate, cup, or clothes, and there's repetitive motor movements such as rocking and hand flapping. Other characteristics that you might notice in a child with autism is flat monotone. Also, they do not reach developmental milestones in neurological time frames or sequence, such as the speech might be delayed by a few years. The way their fine motor skills also develop will be delayed. Also, low muscle tone, like I mentioned before, uneven fine or gross motor skills. They cover their eyes. They do not respond to noise or their name. They act deaf. They will not react to pain. They'll eat or chew unusual things. They'll hit or bite themselves. They'll hit or bite others. And also, frequent diarrhea, upset stomach, or constipation is very common. So what to do if your child is diagnosed? The most traditional thing to do is to have a behavioral analysis program with a trained therapist and proper supervision for 30 to 40 hours a week, with the parent doing at least 6 hours a week. Research has shown that this method of teaching is effective. It is not a cure for all children, but every child can learn and progress. A parent who is involved and neatly aware of the program will be able to help the child generalize skills and get to know the child's strengths and weaknesses. Also, they should start a sensory integration program tailored to the child's needs, overseen by a professional who is trained and experienced in sensory integration. Almost everyone with an ASD has sensory integration difficulties in one or another. This can make it difficult for a child to focus and learn. It is recommended that you follow the DAN approach. The DAN approach is Defeat Autism Now. If a child is having an allergic reaction or intolerant to some foods, he is not metabolizing enough of the nutrients his body needs. And if he has toxins in the system of any kind, or all these could affect his health, his brain functioning, his sensory processing, and his ability to learn. Also, you should try supplements such as vitamin B6, magnesium, and DMG. Data based on thousands of cases and 20 published studies show that these supplements have helped 50% of the children who have tried them. Engage your child in fun activities such as music or singing or horse riding. Involve your child in physical therapy or exercises. If my young child were behind in his developmental levels of gross motor skills, I would have a physical therapist to show me what I can do to help strengthen his muscles. If that were not an issue, I would make sure my child got plenty of exercise, doing things he enjoys. This is a recommendation, but not to be followed strictly. So each family must decide what their child needs are, and what the family's needs are, and what they are capable of taking on before they decide a plan for their child. And the last thing I want you to know is that everybody should become aware. Autism is treatable. Knowledge is key in early intervention and diagnosis. So tell a friend, spread the word, and help us save a life. And now, this is my audience. We have Janessa, my grandma, my brother, my mom, and Kizzle, camera girl. I hope I was able to broaden your horizons on what's out there and what there's to do now for autism. Thank you.